me and have some New Year's resolutions about, eating differently or doing more sports. I think it's a topic that really concerns all of us, and I'm particularly happy that John Ryan, director at DG Santé, based here in Luxembourg, is with us today. He has a vast experience in matters pertaining to health, and I'm sure we are going to have a very interesting discussion, first presentation and then discussion with you here today. From the Commission side, from the representation side, the new year has started in a very sporty way. Perhaps some of you saw on Monday we had the new president of the European Commission, Ursula von der Leyen, with her entire team in Luxembourg. The president met with the Grand Duke and also with Prime Minister Bettel. A number of the new commissioners also had bilateral meetings with the government. I think that's why also part of the representation's job here is to promote these bilateral exchanges. And very importantly also, the whole college swore, had in the solemn undertaking in front of the European Court of Justice, a long session where every single commissioner swears to respect the law, swears to respect the European treaties, swears to respect the Charter of Fundamental Rights, and also swears that he or she will not take instructions from any government or from any other organ. I think this is very, very important to underline. The Commission, the institution that I myself here represent, that John represents, is the guardian of the treaties, and in that context it was more than just a symbolic gesture on Monday in front of the European Court of Justice. From the Commission's side, it's also more than a resolution. It's really the cornerstone initiative of the new Commission is the European Green Deal. We want to be climate neutral by 2050. This is something that needs to flow into all policies and politics of the European Union in every aspect, be it economics, be it in environmental issues, be it in social issues, or also be it for health, which is what we will be discussing today. And it is really essentially a giant strategy, health strategy really for our planet. I think we are all aware that it's not Europe alone that can save the planet. Big partners, important partners need to be a part of this and play an important part of this. This is not easy, but I think the von der Leyen Commission is really persuaded that Europe needs to set the example, and it wants to do so with the European Green Deal. Now this takes, of course, a lot of commitment. It takes a lot of political will. It takes a lot of investment, and in that sense it will also cost. But from the Commission's point of view, there are also opportunities there, and it is seen also as a strategy for growth. So these different parts of the European Green Deal we are going to be discussing in the coming weeks, months, in the next 5 years. May I invite you, perhaps already on Monday, for those who haven't seen or not inscribed yet, we will have a first Citizens Dialogue of the Year in Belval with the Luxembourg Commissioner Nicolas Schmid, because the social dimension of Europe is also directly linked with the European Green Deal. On Tuesday, we will have a specific session, information and exchange session here with citizens about the Green Deal and its link also with COP25, which was not what many of us might have wanted as an outcome, but still this is something we want to inform you about and also discuss. So this will take place here on Tuesday. Everything is linked, but today we'll be speaking about health. So again, John, thank you so much for being with us today. And I really hope after John's presentation, I'm not sure, we seem to have a little digital problem here. I don't know if it is fixed. John will then speak without the PowerPoint that we can probably share with you also afterwards. You have a lot of interesting things to say, and I think for everybody present here today, I hope you really seize this opportunity to bombard John afterwards with questions, comments, what comes to your mind. That's why we're here. So again, big welcome to all of you, and I pass the floor to you, John.
Thank you very much, Yuriko, and thank you for the invitation. And I'm very happy to see so many people here. The last time I spoke in the representation, I think there were 5 people. So it seems to, that was a press conference, okay. So that explains that. But anyway, it's a great pleasure and honor for me to be able to dialogue with you today. And I hope I'll try and stop speaking at a certain point to let time for discussion and for questions. But the first point I wanted to make is the importance of knowing what's going on across Europe. And one of the activities of the Commission is to prepare reports analysing the European situation, but also the national situation. In respect of health, we have quite a number of what we call health indicators, which record the developments in health at a national level. And we have copies of this report outside, which will give you a detailed analysis of the situation in Luxembourg. It was presented here in this room just a few weeks ago, so it's quite recent, and we'll give you an idea of the state of play and the trends here in Europe and also in Luxembourg. One of the points I wanted to make that came up in this report is the importance of mental health. Mental health is not something which relates to people's physique, so you don't actually see if somebody has a mental health problem or not, whereas you can see if somebody is walking badly or if they have problems with their sight and so on. So with mental health, it's invisible basically, and it's really the contact with the individuals concerned and with their families that can betray a mental health issue. The second element which came out in this report, in this analysis at the European Union level, is the lack of efficiency of some of our health investments. You know that member states spend between 10 and 15% of GDP on their health systems. So this is a very important part of national budgets. And I think it's important as well at the European Union level that we compare and we try and improve the efficiency of the investments in health in order to make sure that citizens have the best possible health care at national level. We think that there's about 1/5 of the investments which are being made in the health systems which are being wasted or spent inefficiently. So 1/5 of 10% of national GDP is a lot of money, and I think there is room for improvement there across Europe. A third point I'd like to say is that there's a slowdown in the life expectancy in Europe. So we've seen great developments in the last 40, 50 years in the rates of illness and also in life expectancy increasing across Europe. This is now slowing down, which for us is a warning signal because it means that we're perhaps not investing sufficiently in prevention and that we need to be very careful about the causes of this slowdown. Causes of the slowdown, for example, are cardiovascular disease, which is the biggest killer in Europe, followed by cancer. And cardiovascular disease can be prevented in the same way as cancer can be prevented, either by physical exercise, by nutrition, by reducing consumption of alcohol, and by stopping smoking. These are 4 easy ways to reduce the cancer burden and to reduce the cardiovascular burden. A second example is seasonal flu. Seasonal flu is something for which we have every year we have huge numbers of patients showing up in our hospitals, and it's something which can be stopped, largely stopped or reduced by vaccination. And I'll say more on vaccination later. So these are just 2 of the causal factors which are slowing down the life expectancy in Europe and increasing the burden of disease. And the last point which I wanted to make, which came up from this European level analysis, including Luxembourg, is the importance of prevention. I mentioned smoking, I mentioned alcohol, nutrition, physical activity. All of these are things which people can actually do themselves to improve their lifespan and to improve their lifespan in good health. And I think it's very important that we realize as well, it's not only an individual choice. It's also a question of how you're brought up, what your family environment is, what sort of messages you get when you go to the supermarket, for example. What sort of products are you consuming? What sort of commercial pressures are you under? What products are being advertised? What products are being pushed? And if you go to the cinema like I do, I'm frequently surprised now by looking at the number of people smoking in films. Because if I look around my environment here in Luxembourg, I don't see that many people smoking. It's 1/3 of the population are smoking. If you go to the cinema, and I invite you next time you're in Kinopolis to have a look and to think about this, the number of people who are smoking in films is absolutely incredible. It's certainly more than 1/3. So this is linked to, of course, to the tobacco industry and the way they promote their products, and people are not necessarily conscious of that. So that's what I mean when I say there are personal choices, but there's also the influence of advertising and industry, which we're not always aware of. You don't know perhaps what the sugar content of the soft drinks you're consuming is, because it's in tiny little letters. You need new glasses to be able to read it. So we need to make it more easy for people to lead healthier lives and to avoid diseases which they can avoid. That's the first point I wanted to make. The second point I wanted to make in relation to this analysis is the inequalities across Europe. The inequalities across Europe. I was looking at a report from Eurostat, which is also based here in Luxembourg in Auchan, the Auchan building. They published a report last week which showed the take-up of women breast cancer screening in Europe. There was a take-up of breast cancer screening in Europe, in Romania, of 0.4% of women of the age band which is supposed to be screened, 86% of the same age band in Denmark, 0.4% in Romania and 86% in Denmark. This is absolutely incredible in the European Union. We have the same currency. We have the possibility to travel all around Europe and live wherever we want. We have all the common policies that we have in Europe, and yet we have this huge difference in health. If in Romania you only have a tiny percentage of the population being screened, this means that the cancer will develop before they know it, and they'll find out when the cancer is actually there. Whereas in Denmark you have a much better chance as a woman of having the cancer picked up at an early stage and being treated in time. So for me this is a classic case and a very recent example of inequalities in health. Life expectancy as well. Why should there be a 10-year life expectancy difference between the east of Europe and the west of Europe? Well, we know why, because the economic conditions in the new member states are different from the old member states, and there's a historical thing there. But I mean, is this acceptable that if you're living in one member state, you're going to die 10 years earlier than in another member state? So this is the sort of thing we need to see what we can do about. Also, we think that prevention, as I said, is a major burden on society. It's a major burden on our health systems. 1.2 million deaths per year could be avoided through improving vaccination and stopping smoking. This is just a simple example, a calculation which we did of the benefit we can get as a European Union from improving our prevention policies, vaccination, tobacco. Those are just two examples I would quote. I wanted to spend most of my time this afternoon talking to you about the future rather than looking at these problems which we have. And I wanted to tell you about a number of topics. First of all, the new commission, which has just come into place in December last year, will be there for the next 5 years. And one of the key initiatives which the commission has announced and which we're working on at the moment is the development of a Europe Against Cancer plan. So this is something which is going to be launched on the 4th of February in the European Parliament, and I'll say some words about that. I will also spend some time talking about vaccination, because vaccination is a major problem in Europe. The number of vaccine preventable diseases is increasing, and there's a lot of skepticism and fake information, fake news about vaccination, which are stopping mothers from vaccinating their children and stopping people from getting vaccine preventable treatments. Third item I'd like to mention is part of the Green Deal, which Yuriko just mentioned. It's called the Farm to Fork Initiative. I'll say a few words about that. I'll also talk about climate change, environment and health. And finally, I'll talk about pharmaceutical products. So if I start, I still have no slides, but I'll give you a copy afterwards if you wish. In the area of cancer, the areas which we, in the action plan on cancer, the areas we want to cover are starting with prevention, because 40% of cancers, 40% of the cancer burden, which after all is the second largest disease burden in Europe, 40% of these cancers can be prevented, either by screening, by vaccination for HPV, for cervical cancer, or by reducing smoking, for stopping smoking, reducing alcohol, and so on. The second area which we want to look at in more detail is how to improve cancer screening and make cancer screening more available to the population. The example I gave you of Romania and Denmark at the opposite ends of the scale is perhaps the best example I can give you of the inequalities in access to screening. It's very important that we try and encourage people to find out if they have a cancer risk, whether it's cervical cancer, breast cancer, or colorectal cancer, at an early date. And we also want to look and see whether there are new types of cancers or new cancer sites for which screening might be appropriate. For example, lung cancer screening is one of the examples that's been given at the moment of where a population-based screening might be of interest. A third area is in the area of treatment, because also in Europe, in addition to the differences in access to screening, you also have a problem of access to treatment. You've probably seen in your news, in the press, the cost of cancer treatments can be enormous, especially for new cancer treatments which are coming on the market, the new innovative products. And for a small country like Luxembourg, of course, it's very difficult to negotiate with a giant pharmaceutical company. If you're a big company, a country like Germany or a country like France or UK, it's much easier because you're going to be buying millions of doses, and then you can negotiate your price a bit better. But for a small country like Luxembourg, it's particularly difficult. And access to new treatments in cancer is one of the big challenges we have, because you have more and more people getting cancer because of an aging population, and therefore more and more demand for good quality new treatments. And that's why one of the questions we'll be looking at in this cancer action plan will also be access to treatments. More and more patients are surviving cancer. It's not like in the past where it was a death sentence, and once you heard the word cancer from your doctor, you were already preparing yourself. Now more and more patients are actually surviving and living with their cancer. A good example I can give you are pediatric cancers, where a child would be affected by a cancer and very often cured of the cancer. The problem for the child is that as they grow up, the word cancer will be in their medical file. And if they try and get a bank loan afterwards, if they try and buy a house or a car, if they want to get married, if they want to get a job, all of this will be in their medical file. And there are huge problems about survivorship and stigma, because if the employer sees cancer on the record, of course, they may have unnaturally a reaction to say, well, I'm not going to give this person a job. So this is a problem, survival problem, but also the problem of what happens when you have a cancer in middle age. You have to take time off work. How do we make sure that you can go back to your work and take up your job after having been treated with the cancer? What happens with the people who care for cancer patients? For every cancer patient, there's a husband, a wife, a partner, a family member who's also taking care of the cancer patient. And these are the invisible healthcare workers. There's an army of healthcare workers, unpaid and unseen. And these people often have stress problems of managing their own lives and their own health because they're taking care of somebody else. So it's very important that the linkage between the health system and the social care system is improved, that the health system is not separated by a wall from the social system, because both are very complementary. And this is what we mean by integrated care. So that when you leave the hospital, there's some system there, and there's some people there who can assist you to get back into your normal life. One of the big unspoken issues is the end of life. The end of life. I don't like speaking about it in a health conference, but it's an important aspect. So in Luxembourg there are certain laws regarding euthanasia and palliative care, end of life. And it's important that we compare the experiences across Europe so we can see to what extent we can help people who arrive at the end of life because their cancer is incurable. Something we have to talk about because it's a real problem. And finally, on the issue of research, I think Europe has a huge opportunity to do research on the causes of cancer, and this will also be part of our plan. There's a cancer mission which is being developed at the moment, which will try and develop a 5-year plan for cancer research and really make Europe a leading center for cancer research in the next 5 years. So that's all I wanted to say about vaccination. I'd be very happy to come back later and take any questions or ideas you might have. On the vaccination issue, I'd like to say a few words about the topic of vaccination. The Commission is working with the Member States at the moment to make sure that on the national level, there would be national plans for improving vaccination services and promoting vaccination. We want to have, if possible, for measles, which is a communicable disease, a transmissible disease, for which there are outbreaks all over Europe at the moment. We want to make sure that there is a coverage of measles vaccination in the population of 95%. This is the World Health Organization recommendation, and there are more and more member states in the European Union now which don't reach this 95% coverage, and that's why we see outbreaks of measles in our schools and in different communities in member states. You might be interested to know that you've probably heard about Ebola in the Congo. What a terrible thing Ebola is. Now, 3 times more people killed in the Congo from measles than there were from Ebola. I'm not laughing about it. I'm just saying that it's such an amazing figure that people don't realize the danger of measles compared with some of the other things which are in the newspapers. Ebola is very serious. Ebola is very easy to transmit from person to person, but 3 times more people died in the Congo from measles. So this is how serious it is, and we have many European countries which have outbreaks of measles at the moment. So we really want to work with the member states on that. We also want to improve controls on the population of vaccine status, more regular controls of the population on vaccine status. For example, in schools, more and more countries are looking at how to improve the vaccine coverage of children in schools, but also, for example, young girls who are coming to the age of puberty, how to improve the level of coverage of human papillomavirus vaccination to stop cervical cancer developing. That's a second example. A third example is in the elderly population. I mentioned seasonal flu. There is a vaccine against seasonal flu. That's a third example of where elderly people can also be targeted for vaccination to reduce the levels of seasonal flu. So this is something we're working on with the member states at the moment to try and improve vaccine coverage. And in order to help people, including those here in the room, to take ownership of the vaccination that they receive, we're going to develop a European vaccine card. It's a little bit strange that for your dog, if any of you have dogs in the room, you will have a vaccine card for your dog, but you don't have one for your child or for yourself. So in other words, dogs are better protected by the European Union at the moment than, as regards vaccination, than humans. And we really want to try and improve that situation by providing a European level card so that when people travel around, they will have a similar level of protection from vaccine preventable diseases. It's really just a record which you keep in your pocket of the vaccines you've received, and it will be applicable across the European Union. So that's the idea, to try and improve the level of protection of health of children in the same way as we do already for our dog population. And of course, we'll be also trying to improve the level of information for patients and for citizens, because depending on what member states you're living in, you have a different access to information. The big member states have developed portals, they've developed information tools for citizens on vaccination, other people are forced to go on Facebook and do a search, or on Google. And unfortunately, the information they get is very often fake information. There's a lot of fake information about vaccination, and particularly about side effects. People have no clue about the systems we have in place to protect against side effects. We have huge systems in place through the European Medicines Agency, through all the national authorities to protect people against side effects. And yet none of this is widely known, and it's information which we would like to provide to people to let them know that the medicines and vaccines that are on the market in Europe are safe. I think that's an important point. So, European Information Card. We're also planning to develop a stockpile of vaccines at European Union level, because very often the smaller member states have difficulty in receiving supply of vaccines. And we have several examples of where member states have tried to help each other with outbreaks. There's an outbreak in Spain. The Spanish might not have enough doses to be able to control the outbreak, and therefore they ask for help from the other member states. So we're trying to create a collection of a stockpile of vaccines to control outbreaks. And finally, I would mention the topic of health professionals. Health professionals receive, on average, 2 to 3 hours of training on vaccine topics during their professional training. 2 to 3 hours. And don't forget, many of them study for up to 7 years. So this gives an indication of the amount of investment that's made during the training curriculum in the medical schools. And we think that really vaccination is such an important topic that we should increase the training that's available to medical professionals on vaccination. That's something where we can also share a lot of experience and good practice across Europe. Since I still don't seem to have any slides, I'll continue as I'm going, and I'll give you the slides later. A topic I wanted to talk about in a few words is antimicrobial resistance. You know, when you have a bacterial infection, we have what we call antibiotics, which are prescribed to you by your doctor and which are supposed to deal with the bacterial infection. Problem is, of course, that many times, oh, there it is finally, that's good. I feel a little bit reassured. Here we are. So it's a big problem, because very often doctors will prescribe antibiotics before they know whether it's a bacterial or a viral infection. So therefore, can you imagine you're taking tablets for something for which the tablets will have zero effect? They'll have a negative effect, in fact, because they will increase your resistance to a bacterial infection in the future if you have one. So the necessity for doctors really to know very, very quickly whether it's a bacterial or a viral infection is really a key thing. And that's why we're trying to invest in diagnostic tools to be able to distinguish whether it's a bacterial or a viral infection. The problem is, in an urgent case, of course, the doctor will give you an antibiotic just to be on the safe side. The problem is, of course, that increases the resistance in the population. So we have a big problem with antimicrobial resistance in Europe, particularly in the southern member states, because the prescribing practices of doctors and hospitals is different than it would be here in Luxembourg or in Netherlands or in the northern member states. So if we look at the map, we can actually see a geographical difference between the southern and the northern member states because of hospital and medical practice. And this is something we really want to try and deal with at European Union level. Just to give you an idea of the size of the problem, it's 25,000 deaths per year in Europe because of antimicrobial resistance. 25,000 deaths a year. So people are dying across Europe because of a largely preventable problem again. And if you look at the cost of our health systems, it's 1.5 billion euros per year caused by antimicrobial resistance. So we really want to make progress on this topic. And in order to do that, we've created a European Union initiative where you can see a number of actions that we have taken. For example, we have just introduced legislation for veterinary medicines for animals, because animals consume the same antibiotics that we consume. So in other words, if you have a sick cow, the vet will come to your farm and prescribe antibiotics for the cow. We don't know what the effects of that, eating that meat from that cow will be, or drinking the milk will be on human populations. So there's a strong possibility that the antibiotics consumed in animal health will be transmitted to humans. So we have all sorts of actions which we put in place at the level of the European Union to try and reduce the use of antibiotics in animals as well as humans, strange as it might seem. You can see on this slide here, for instance, the size of the problem in terms of the burden of infections. In 2015, which is the latest slide which I have, in Italy there were 10,000 infections compared with Portugal, where there's 1,000 infections. So you can see from member state to member state, the practices are different and the burden is different. And we're really working with the member states at the moment with health professionals to see how we can try and reduce this burden. Very important problem in public health. The next area of work I wanted to mention to you in terms of health is climate change. And there will be a Commission initiative which was launched in December, which is called the Green Deal. And this Green Deal looks at things like clean energy. It looks at sustainable industrial practice, respecting the environment, and construction sector, a more sustainable and clean construction sector. Also in terms of mobility, how to ensure that transport is less polluting, increase biodiversity, and then we come to the point that I'm dealing with, which is the Farm to Fork initiative. And the Farm to Fork initiative is dealing with how to improve production of food, the sustainability of our agricultural systems, but also providing people with nutritious and healthy diets. And this is something we're working on at the moment, and we hope to launch in May of this year. And of course, reduction of pollution as well. So you can see on this slide the question of air pollution is, I think, interesting to look at. You can see that the figures are generally speaking getting better between the year 2000 and 2017, but still in certain areas, and this is an issue of inequalities, there are huge differences again between the member states. Depending on where you live, the quality of the air is completely different. So you have certain cities and certain areas which are close to industrial sites, for example, where the level of air pollution is huge. And it's particularly a problem for children and children's health. So this is really a topic which is going on across the different policies at the European Union level, but there will be a health component. And you can see on this slide that there are questions around climate change. You've probably heard about Lyme disease, for instance. Lyme disease is transmitted by ticks. So if you go for a walk in the forest, you should be very careful in Luxembourg about getting bitten by a tick, because many ticks are carrying Lyme disease. And this is something which I would not have said to you 10 years ago. It's moving with the temperature. In other words, as the climate is increasing, temperature is increasing, the number of these communicable diseases which are spread by ticks or by insects is increasing as well. We have cases of malaria now in Europe. You might have been expecting to hear about malaria in Africa, but it's now a European problem. Dengue is a European problem. Chikungunya is a European problem. So we have many of these diseases which are migrating north. We need to be ready for this. We need to prepare our health systems. We need to have the systems in place in the laboratories to pick up these diseases. We need to be careful, for example, with blood transfusion. If somebody gives their blood, that they're not transmitting at the same time chikungunya or dengue or malaria. So this is just an example of the type of problem we're going to have in the future. It's not only a question of the temperature increasing, it's also the direct health effects for our populations of climate change. And I wanted to mention quickly the problem of pharmaceutical products. A lot of the costs on our health systems is down to the cost of pharmaceutical products. And of course, our industry in Europe is a strong industry. It's a research-driven industry. It's an innovative industry. But of course, Problem is when it comes to paying for the new drugs and new products which are put on the market. So we want on the one side to encourage research, to encourage innovation, to encourage the fact that citizens in this room would have access to the best quality treatment that's available. Problem is, how do we pay for it? How do we analyze the value added of new products? And the Commission has made a proposal in that respect, which we're going to try and take forward with the Member States, to analyze the new products which come on the market and to make a recommendation as to the value added of those products. It's called Health Technology Assessment. And the idea is that instead of the 28 Member States separately evaluating these products, that we would do it together. So if you have a new product coming on the market, it's authorized centrally, but then the analysis of the value added is done separately. So it's a bit strange, and that's why the Commission has made this proposal to have a unified approach. And you can see here on this slide the generic market. Generics are products which are identical to normal pharmaceutical products, but which are much cheaper. And you can see that, for example, Luxembourg over there is one of the countries with the smallest take-up of generic products. In other words, the rest of the slide is the normal full-price pharmaceutical products, whereas these other countries have replaced the high-priced products here with generic products here. So you can see that there's a lot of difference there as well in the pharmaceutical market between the member states. The final point I wanted to talk about is quality of food. And I'm starting to get hungry because I missed my lunch today. But what we're trying to do with the Farm to Fork initiative is really to stimulate agricultural production, to protect the environment, to reduce the impact on climate change, to stimulate sustainable growth in the agricultural sector, to promote sustainable consumption in terms of healthy nutrition. So nutrition is really a very important determinant of health in the same way as smoking or alcohol. It's really a key way of keeping the population in good health, and that's why we were really putting a great attention on quality of food, reducing food waste. Huge quantities of food thrown away every year in Europe. It's a waste for the environment, it's a waste for the system, it's a waste for consumers. You're paying for it and you're dumping it. So if you look at the supermarkets every time, how much food they throw away, this can't continue in the future because it's not sustainable. And of course, we're trying to do this as well internationally as well as domestically. So in the few minutes which I had this afternoon, I wanted to give you a flavor of the size of the problem, the areas where we think there is progress to be made, and the vision for the next 5 years at the European Union level. And I spoke in more detail on some of these topics: cancer, vaccination, antimicrobial resistance, pharmaceuticals, and so on. And it's really been a great pleasure to speak to you, and I hope that for the remainder of the session we can have a discussion and answer any questions you might have. Thank you.
So please, now is the time for Q&As, and if you want to wait, just that I come with the microphone. And questions can be asked in French or in English, en français ou en anglais. J'ai une première question, j'arrive tout de suite.
C'est très gentil, merci beaucoup. Yeah, d'accord. C'est bon maintenant. Thank you very much for the very inspiring talk. Thank you for the presentation, sort of detail. I would have two questions concerning, if I may, two rather new subjects, which both are pertaining to the health as well, potentially. One would be the new, like biohealth, the new robotics in this kind of sector. If you can perhaps allude as well on the diagnostics, if those are things also studied by your groups. And the second is 5G, because obviously the debate about this ultra connectivity is looming around. Some people sort of it's scarce as well. Would you comment on those two subjects? Thank you.
Yes, so one of the priorities of the next Commission for the next 5 years will be Digital Europe. We think there's a great potential within the developments on IT to improve our societies. We think it's one of the transformational factors for Europe in the coming years will be how we use IT and integrate IT. You're already living with this. I mean, everybody has their iPhone, and you have access to huge quantities of data just through this simple instrument, which you would not have had 5-10 years ago. So we want to exploit this and try and make it a transformational thing in the society in Europe. And of course, it can also transform health. At the moment, health systems are very often constructed in what we call silos or boxes. So your dentist, for example, he'll have a certain amount of data on you in his or her medical record. Somebody else will have data on you somewhere else. The Social Security, the health systems will have. Now, some countries have a unified health record, electronic health record, but many don't have an electronic health record. And we think that there are great advantages to having an overall approach to having everybody's information in an accessible way. And I know there are specific initiatives that have been taken here in Luxembourg which allow the patient to decide if they want to open up their information to all the carers that they may be seeing. In other words, their hospital, their GP, their dentist, and so on. So this is one aspect. The other aspect is how do we use people's data to improve research and to provide quicker treatments? An example of a project which we're dealing with at the moment is to bring together electronically the cancer screening images from breast cancer screening. So can you imagine how many women have gone through cancer screening every year in Europe? Millions. And all of these images are sitting somewhere in some radiography cabinet or in some patient's chest of drawers. The idea is how can we open up this data and make it more accessible to research? And one of the ideas we have at the moment, and which we're actually working on here in Luxembourg in the department, the digital department, is to actually use machine learning, IT, artificial intelligence to read the screens. Because at the moment, you know, you've probably seen this in the cinema, you may have seen it yourself. The doctor will put up your screen on the wall, and then he'll have a look, and then a second colleague will come along and he'll have a look. And then finally they might decide to do a biopsy, or that's how it works. In the future, what we hope to do is to improve the reading of these images by artificial intelligence. So that's something which we're working on at the moment. The second example you mentioned was on 5G. 5G is a new technology for mobile phones. We're waiting at the moment to receive the opinion of the international organization which evaluates the health risk of mobile phones technologies. It's connected with the World Health Organization. They were supposed to publish their report in October. They haven't published it so far. So we're waiting for that to be published in order to evaluate the level of risk. Is there a higher risk or a lower risk from 5G technologies than there is from 4G technologies? The only thing I would say is 5G follows 4G, follows 3G, follows 2G. So I don't see people dying in the streets because of their mobile phone. In fact, the evidence which we have at the moment, on the basis of the safety levels which we have in Europe, we have European safety levels, there is no evidence that there is a risk from mobile phone technologies for the general public. And for professionals, there are stricter rules in place. So in other words, if you're working in the airport, on the radar in the airport, then you have to respect stricter rules. You cannot be exposed to magnetic radiation over a certain level. But for the general population, we have no evidence that the existing, and believe me, I'm not an advocate for mobile phone technologies. I'm just telling you what we know, that there is no evidence that there is an increased risk at the moment, but we're looking at the evidence on a continuous basis.
Thank you for your inspiring talk. You have mentioned the Europe Against Cancer plan. And I hope that breastfeeding will be really at the top level of a way of preventing childhood cancers and also cancers in women, as there is a dose response effect with longer breastfeeding. And in this way, I would ask, Europe has not yet legislated on breastfeeding breaks for women going back to work. How could this be initiated to become a EU directive covering breaks for women so that they can for longer breastfeed when they are going back to work? That's my first question. The other point is you spoke about the Green Deal and climate change. Just be aware that breastfeeding also is nearly climate neutral, and where the substitutes have a huge impact on resources and producing waste and using energy. So there's another reason for protecting and putting breastfeeding more high up on EU agenda.
So there are two issues around breastfeeding. The first issue is public acceptance and acceptance by mothers of the need for breastfeeding and the reasons why they should breastfeed. So I think there's one effort to be made to communicate to mothers effectively and to communicate to people around mothers that this is something which needs to be done for the health of the mother and the health of the child, particularly the health of the child, of course. So it's really an important determinant for children's health. And it's something which I think all doctors, all health systems, and all international organizations recognize. The problem is that there's a gap between that and what women actually do, what mothers do. And I'm not putting the blame on mothers. I'm just saying that in the same way as for vaccination, there's a gap between what we know we should do and what we actually do. So that's, yes, they need more support. And that was my second point. I think mothers exist in an environment, so we have to be in an accepting environment. Societies have to accept that mothers should breastfeed and provide places for them to breastfeed. In other words, in the workplace, to provide the spaces for mothers to breastfeed. And also, there is legislation at the European Union level on certain aspects of pregnancy and protection of pregnant women, for instance, in the workplace. And the Cancer Action Plan will actually include initiatives from all over the policy perspective. So it will be possible for us to discuss with our colleagues in the Employment Directorate General to see if they have any ideas for which we could include. Perhaps breast cancer breastfeeding could be one of those examples where we could try and improve the take-up of breastfeeding and also look at the legislative possibilities. I mean, I'm not saying we will or we won't. I'm just saying it's there, the possibility is there.
Hello. I'm very happy to hear that the European Commission invests into health and that you specifically mentioned the problems of smoking, reducing smoking and prevention. Because I work with a Swiss company which invests and develops innovative technologies for respiratory training. And I'm happy also that you mentioned the specific topic of cancer being an issue for employers. And I tried out this, so I took these arguments and I went to employers asking them to invest into respiratory training, which would take each employee 30 minutes per week. And they said to me it was the waste of time. So my question now is, could you give me an advice? I mean, you as European Commission invest into health and are aware of these issues. So what would you recommend a company or a self-employed person to convince an employer to invest into health?
We have actually had very good contacts with different employers on different topics. A good example I could give you is in the area of mental health, where the Commission has engaged with employers to try and improve workplace health promotion on mental health. And believe me, the biggest companies in Europe are actually investing. They have HR resources which are thinking about mental health, because mental health is one, together with musculoskeletal problems, mental health is one of the big issues why people stay at home, why they don't come to the office. So there are all sorts of things where we can work with industry, we can work with employers. It's not just a question of passing laws, it's also a question of identifying what the advantages are to the companies. Economic, real money. They will have to spend less. They will have their workers in better health for longer. And I think smoking is a very good example. We are lucky in Europe, we're very lucky in Europe to have seen progress made over the last few years in terms of the acceptability of smoking. The acceptability of smoking, I mean also the protection of non-smokers. Because I remember when I started in the Commission, I was sharing an office with an Italian colleague who was smoking 2 packages of cigarettes per day. In other words, I was smoking 2 packages of cigarettes a day as well, because I mean, I was sharing the office with him, so I was just at the same distance as from that table there. And this went on for 5 or 6 years. Luckily, we've moved on since then. We don't have the same exposure of passive smoking, but I think we need to help the 1/3 of the population who continue to smoke. And clearly, the employers also have a role to play there. They have a role to play there in their own interest, I would say, in the interest of their workers, but in their own interest economically as well. So, I mean, we have European programs which can finance this type of action. That's another possibility. If you want to engage with employers, they have their own representative organizations, but the European Union also provides financial incentives for this type of initiative. Sorry, there was a lady in the front. Beg your pardon.
Pass.
Thank you. I'm thinking particularly about vaccinations, antimicrobial resistance, pharmaceuticals. When you look at, when you're sort of comparing European member states, there are some countries maybe that are doing better than others. How easy is it to sort of take good practice from one country and then maybe use it for the rest of the member states? So, for example, if one country has low vaccination take-up and one country doesn't, or one country has low antimicrobial resistance and so on.
We absolutely don't want a single European system. What we want to do is try and solve a problem or help people to solve a problem. So we're not going to come with some magic solution from Europe to impose on the member states. Each member state has a different situation and each member state's problems are different. So it does make sense for member states to speak to each other. Now I have a very concrete example of something we did recently, which Luxembourg is involved in as well, which is a project which we developed on cardiovascular screening. I mentioned to you that cardiovascular problems are the largest cause of death and mortality in Europe, followed by cancer. One of the initiatives we took was to take a project from Italy on cardiovascular screening. In other words, how do you find out early on that somebody has a problem with a cardiovascular problem? How do you identify these people quickly and early on, and then take the necessary measures to try and reduce their risk in the future? We took a project from Italy. We gave the opportunity to the member states to study the project, which had been evaluated as efficient. So it wasn't just a test case, it was an evaluated effective intervention. And then the European Commission took the project with the member states who were interested, including Luxembourg, and that's now scaled up across the European Union with the interested member states using our funding. So that's an example of where we try and take something that works somewhere and then scale it up or offer it to other people. And the example you gave of antimicrobial resistance is a very good example. You know, in Netherlands, for example, they have a practice for many years in Netherlands of screening people when they go to hospital for antimicrobial resistance. It's the first thing they do when you walk in the door. Well, they probably put you in a bed or something. But then the next thing they do is they check whether you have a resistance to antibiotics. And in this way, they can screen the patients and make sure that the infections are not transmitted between patients in the hospital. So in terms of antimicrobial resistance, Netherlands is doing very, very well because of this practice of entry screening in the hospitals. And that's a very good practice that could be extended to other member states with some seed funding or some incentive funding.
I've got a question concerning young people, especially when you work with them on an international or intra-European level. First, the lowest drinking age is 16 here in Luxembourg. In other countries, it's much higher. So how do you go about this from a European viewpoint? Is there a directive concerning how these can be solved? That is one question. And the next one is what with the liberalization of cannabis all over the world and also within the European Union, is there any directive coming from the Commission as far as the legalization of cannabis is concerned?
So on the first question, the rules regarding the availability of alcohol are determined at national level. In other words, which shops can sell you alcohol, at what age, at what time of the day or night. This is all dealt with at national level. But what we do is we exchange information between the member states so that they know what their neighbours are doing and they can compare and also see what the approaches taken at national level are and what the effects of those approaches are. So we try and facilitate that discussion between the member states, but it's not a European Union competence or decision to impose an age limit, for example, on the consumption of alcohol or the sale of alcohol products. Now, there is an exception to this in terms of the promotion of alcohol products, because we have what we call the Audiovisual Media Services Directive. And the Audiovisual Media Services Directive has specific provisions regarding alcohol and promotion of alcohol. Promotion of tobacco, of course, is banned, but there are specific provisions regarding the promotion of alcohol to young people, and also the promotion of foods which are high in salt, sugar, and saturated fats. So this is an example of where, even though the European Union doesn't fix limits or restrictions on alcohol sale or consumption, we do have instruments which we can use to, for example, reduce the impact of advertising on young people. Another example I could give you is in relation to road safety. We had a major conference here in Luxembourg in October in relation to safety and prevention. And of course, alcohol is a major cause of road safety accidents. And the member states have together introduced guidelines for member states to control alcohol consumption and driving on the roads. So without answering specifically your question on young people, except for the promotion side, we do work with member states on trying to develop strategies, and we pay for strategies from the European Union budget to try and reduce the impact of alcohol on young people. Yeah, well, that's Europe. I'm afraid we have to take account of each country's approach, and there is nothing which allows us to propose a common guideline at the moment, although we do have common rules on promotion of the product. The second question you asked is about cannabis, and the European Union does not have a common rule on liberalization of cannabis. We are having in the coming months, and I think it's ongoing at the moment actually, is a public consultation on our drug strategy. So if you do Google search for public consultation drug strategy, you'll find the proposals of the Commission asking for feedback from the public and from experts on where we should be going over the next few years on drug strategy. I know that, for instance, Luxembourg has taken a very, very strong leadership role on prevention of drug-related infections, and I myself visited the Abrigado facility behind the station in Bonnevoie, where it is really an impressive example of how the health system has mobilized to help people really at the total margins of society and giving them a place where they can go to get advice and get help and reduce their infection. It's really an impressive initiative, and one which is being repeated in Esch at the moment, but it started, I believe, in Switzerland. It started in Switzerland, then it moved to Netherlands, then Portugal, and then Luxembourg. So even your big neighbours in the south have not taken up this initiative, and people are still injecting in the streets or in street corners and so on. Luxembourg has taken a very strong leadership on that. So I think it's well connected. Luxembourg is quite well connected in terms of how to control drug-related infections in that respect.
En français, si autorisé? Oui. Donc, je constate depuis un certain temps dans certains pays la privatisation de la médecine, c'est-à-dire l'Italie, Portugal. l'accessibilité étatique n'est pratiquement plus garantie. Deuxième chose, je constate le manque de médecins, surtout des généralistes, et je constate aussi que des médecins bien formés qui viennent des pays ex-Union soviétique, au Luxembourg, parce qu'ils sont mieux payés, donc il y a un vide dans leur pays. Et la troisième question, qu'est-ce que vous faites avec les approches religieuses pour refuser la vaccination, vu qu'on touche à un droit, théoriquement, de démocratie? Voilà.
Voilà, trois questions intéressantes. D'abord, l'organisation des soins. Il est marqué textuellement dans le traité que l'organisation des soins est une compétence des États membres. Donc, la Commission est très réticente à donner des avis aux États membres en matière de comment est-ce qu'ils organisent leur système de santé. Et parfois, ça change aussi. C'est comme des vagues. Donc, dans certains pays membres, ils décident de privatiser et ensuite, ils nationalisent de nouveau quand ils voient que ça ne marche pas. Donc, c'est aussi une question politique. C'est une question politique. Et comme j'ai indiqué tout à l'heure, le fait qu'il y a 10% à 15% du GDP, du PNB, qui est consacré aux soins de santé, c'est une poste énorme dans les budgets. Et donc, il n'y a pas de volonté politique d'augmenter cela, c'est plutôt une pression de le réduire. Et donc, c'est ça l'intérêt de comparer aussi les systèmes de santé. Les commissions travaillent pourtant avec l'organisation de OCDE à Paris pour comparer l'efficacité des soins de santé. Je crois que j'ai commencé d'ailleurs en parlant de l'efficacité des systèmes de soins de santé. Et on a estimé récemment qu'il y a une cinquième des investissements qui sont mal gérés ou mal investis. Donc une cinquième, c'est énorme. Ça fait qu'il y a un pourcentage de possibilités pour nous d'augmenter notre rendement, d'améliorer l'organisation et la livraison des soins à la population. Et c'est ça qui explique aussi un peu les différences de résultats. Parce que ce n'est pas seulement lié au taux de tabagisme ou de consommation d'alcool, c'est aussi le système de soins qui a un impact sur les indicateurs de santé. Donc, on ne va jamais, à mon avis, avoir une seule et unique service de soins de santé qui va couvrir les 28 États membres parce que c'est une compétence nationale qui est liée au système fiscal aussi. Parce qu'il y a dans certains pays, l'investissement fiscal dans les soins de santé, c'est plus élevé que dans d'autres. Et ça, il faut voir aussi quelle est la décision du gouvernement, du peuple, d'investir dans leur système de soins. Et la deuxième question que vous avez posée, c'est au sujet de la disponibilité des professionnels de soins de santé. Ça, c'est un grave problème en Europe pour l'instant, aussi bien au niveau des médecins, des infirmières et de tous les personnels de santé. Et donc, après le dernier élargissement de la communauté, il y avait effectivement un flux de gens qui sont venus dans les pays de l'Ouest, dans l'Europe de l'Ouest, venant de la Pologne et de la Roumanie, etc., qui étaient attirés par des salaires plus attirants. Je connais même des dentistes qui partent chaque vendredi soir de Warsaw pour aller travailler au Pays de Galles et le dimanche, il revient. Et l'argent qu'il gagne pendant le week-end au Pays de Galles est l'équivalent pour un seul week-end du salaire mensuel en Pologne. C'est juste pour vous donner une idée. Donc, l'attirance de l'argent, ça joue fortement. Mais le deuxième problème, c'est l'âge des professionnels de la santé. Si vous regardez le taux, le niveau d'âge dans les différents États membres, il y a certains États membres qui ont un grave problème avec le profil de leurs médecins, de leurs professionnels de la santé, parce qu'ils arrivent presque à la retraite et la nouvelle génération n'est pas là. Donc, la Commission aussi travaille avec les États membres pour voir quelles sont les solutions à attirer et à créer des moyens humains pour que nos systèmes de soins de santé soient d'abord financés correctement et qu'on ait accès à un personnel de qualité et bien formé. Mais ce n'est pas un problème très simple à régler. La troisième question que vous avez posée, c'est l'influence religieuse dans la vaccination. Et effectivement, c'est un problème dans certaines parties du monde. Ce n'est pas à mon avis, une énorme difficulté en Europe. Et je ne vais pas rentrer dans les détails. J'ai quelques exemples, mais je ne vais pas rentrer dans les détails. Souvent, lorsqu'il y a une alerte dans une communauté religieuse, ce que les États membres font, c'est de rentrer directement en contact avec les dirigeants de cette communauté pour essayer de les persuader à faire vacciner les enfants, par exemple. Il y a plusieurs exemples que je peux donner qui ne sont pas des alertes nationales, mais aussi des alertes qui sont transfrontaliers. Donc, c'est certainement un problème. Plus en Afrique, je dirais qu'en Afrique et en Asie, on se souvient que la raison pour laquelle Ben Laden était assassiné par les Américains, c'est parce qu'il y avait 2 vaccinateurs qui sont arrivés à sa porte. Donc, dans certaines parties du monde, il y a des médecins qui sont tués aussi pour le fait d'avoir vacciné des enfants. C'est le cas en Afrique, c'est le cas en Asie. Ce n'est pas le cas en Europe pour l'instant. Donc, on va travailler avec les communautés religieuses et on va travailler avec les médecins aussi pour essayer de passer des messages et passer une information plus fiable à la population pour les encourager à se faire vacciner.
Dans l'Allemagne, ils sont en train de faire une loi pour forcer tout le monde à se faire vacciner parce qu'il y a eu une épidémie.
L'Allemagne n'est pas le seul pays concerné. Il y a la France qui a commencé, l'Italie, la Roumanie et l'Allemagne. Donc, il y a plusieurs pays qui font la même chose parce qu'il y a une résistance dans certaines populations à se faire vacciner. Mais ça affecte tout le monde. Parce que c'est les autres qui sont affectés aussi. Donc,
Hello. You mentioned the importance of nutrition and of preventing diseases. There are currently many facts, science is stepping in, showing different facts, how important it is to reduce the meat consumption and eat more plant-based. I'm just wondering, are there any current projects from the European Commission to support these facts?
well, I'm not going to talk about religion, and I'm not going to talk about meat, because
for
these
the
are
health
two,
and for the environment.
these are two explosive subjects. Let me say that different international organizations have different recommendations. I think most health administrations would look to the WHO, the World Health Organization, for advice on issues around topics like nutrition or vaccination. And that's our case as well. So many of the ideas we have for improving population health are ideas which have been validated by the member states in the World Health Organization. They're science-based advice. And an example of that would be the Europe Against Cancer Code. It's 12 commandments or 12 recommendations which are made to the population to improve their chances of not getting a cancer. And one of the recommendations is on obesity, good nutrition, and physical activity. So these are issues which are related. And for us, we try and encourage, for example, industry to make available to people food which is low in added sugar, salt, and saturated fats. We have been working with industry for many years to try and reformulate their products. If you go to a supermarket in Luxembourg, for example, you go to your Cactus, if the Luxembourg authorities decide to change the law tomorrow, problem is that the products are made in Germany or the products are made in France. So are they going to rechange the products only for the Luxembourg market? No. So this is why a European approach is quite interesting, to make sure that big companies which are manufacturing widely consumed products, and I'm not going to mention any names, are safer in terms of, or better nutritional quality. A second example is the Common Agricultural Policy. It's very often seen as a way of delivering financial support to farmers in Europe, and it is. But it also provides for milk and for fruit and vegetables for our school children across Europe. It's less known, but that's also part of the Common Agricultural Policy. So if you go to a school in Europe, the member states have the possibility to take benefit from the Common Agricultural Policy to actually improve children's fruit and vegetable take-up, and also to provide them with fresh milk. So I think the European Union policies, including the Farm to Fork initiative, which we're talking about here, will try and encourage more sustainable agriculture, more sustainable consumption, and better diets for the population, because better diets are a key determinant for many non-communicable diseases.
Okay, we're going to take one last question to close the round. Madame was first over here.
I just wonder if you could elaborate a little bit more the new HTA approach you plan to set up.
Well, it's publicly available. It's the health technology assessment. So the idea is that at the moment, each member state analyzes a new intervention, a new product, a new pharmaceutical treatment. They analyze the value added for the health system individually. So you have 28. Imagine you had a new diabetes treatment, for example. This would be, at the moment, be evaluated separately. And therefore, the reimbursement and the availability of the product will be decided on the basis of the national evaluation. Whereas the approval of the product, the safety of the product, is determined centrally in the Medicines Agency in Amsterdam. So the European Medicines Agency will decide on the safety of the product depending on the clinical trials. But then the value added of the reimbursement and the making available at the national level is done separately. And it seemed to us that it would make more sense to have a common evaluation. And this is at the moment being discussed in the European Council, the European Parliament, and the member states are discussing between how far they want to go in having this common assessment.
Well, this closes the round. If you want, maybe you can have some more questions afterwards. Many, many thanks to Mr. Ryan for being here with us today to talk about the importance of health. Thank you all as well for joining us. And since we have live streamed the session today, you can go on to our YouTube channel and rewatch it anytime you'd like. Thank you. Merci.